Ladies and gentlemen, welcome, and thank you for joining today's web conference, Complexity Analysis Tools. Please note that all participant lines will be muted until the Q&A portion of the call. We will provide you with instructions on how you can ask a verbal question at that time. You are also welcome to submit written questions during the presentation, which will be addressed during Q&A. To submit a written question, please use the chat panel on the right-hand side of your screen and make sure to choose all panelists from the Send To drop-down menu. However, if you require technical assistance, send a note directly to me, the event producer, or call our help desk at 888-796-6118. With that, I'll turn the call over to Liz Fernandez. Liz, please go ahead.
Good morning, everyone. I'm Liz Fernandez with the Professional Development Services Branch, and I'd also like to welcome everyone to today's webinar. So we have 4 speakers today. We're going to start out with Dr. Leslie Cole. Dr. Cole serves as USDA APHIS Veterinary Services Area Emergency Coordinator for Arkansas and Oklahoma, working out of the Oklahoma area office. Dr. Cole earned her Doctor of Veterinary Medicine from Oklahoma State University and became board certified in the American College of Veterinary Preventative Medicine in 2012. Dr. Cole's current activities for USDA include working with federal, regional, state, tribal, county, and local entities in agroterrorism awareness education, biosecurity awareness, incident command system training, and coop preparedness and planning. Dr. Cole has participated in various emergency and animal disease responses, and she currently serves as a Deputy Planning Chief Section on one of the 4 USDA Veterinary Services National Incident Management Teams. Our next speaker will be Dr. Maggie Baldwin. Dr. Baldwin is the Animal Incident Management Specialist with the Colorado Department of Agriculture State Veterinarian's Office. Prior to joining CDA, she worked for USDA's Animal and Plant Health Inspection Service and the Food Safety and Inspection Service. She is originally from Hoffman, Minnesota, and received her Doctor of Veterinary Medicine degree from the University of Minnesota. She currently lives near Johnstown, Colorado, on a small farm with her husband and 2 sons. Our next speaker will be Darrell Swilling. Darrell is retired from the U.S. Forest Service after 37 years of service. He has been involved in incident management for over 30 years, a Type 1 Planning Section Chief for over 16 years, and was a member of the National Incident Management Organization of the Forest Service from 2006 to 2017. His experience includes management and mentoring on all hazard incidents such as safety and security for 2 Super Bowls, the recovery of the Space Shuttle Columbia, citrus canker in Florida, and avian influenza in Virginia and Iowa. He has experience as an ICS instructor for courses such as 300, 400, 440, 420, and 520, and that experience includes T3, IMT, and S420 for state agricultural departments in Virginia and Iowa, Command and General Staff for USDA, and 3 annual sessions of S420 for APHIS and the Oklahoma Department of Agriculture. And our last speaker is Chuck Vail. Chuck is the Regional Field Manager for the Colorado Office of Emergency Management. He has 49-plus years in public safety, has served for 12 years on an IMT, and has been deployed all over the country on all hazard incidents. He knows agriculture, is an active rancher in northwest Colorado, and has assisted in the development of several complexity analysis tools that are used in Colorado. And with that, I'm going to now turn the webinar over to Dr. Leslie Cole.
Thank you, Liz. Good morning, everyone. This is Leslie Cole, and I am currently at the Incident Command Post for the California V&D response in kind of rainy Southern California today. What we're going to talk about today is ways to think about and quantify the complexity of all the different ideas, factors, complicating things that must be considered when we as incident responders try to size up an incident and develop effective tactics, effective personnel rosters, effective equipment rosters, effective supply rosters, and to supply our agency administrators with decision support information, and for us to also justify the needs that we have up the chain. Okay, complexity, and this is an incident response take on the definition of complexity. Complexity is generally used to characterize something with many parts where those parts interact with each other in multiple ways. In the context of this analysis, complexity refers to the interconnectedness and dependence of individual elements as they relate to planning and implementation of the incident response. And this is an excerpt and paraphrase from the Prescribed Fire Complexity Rating System Guide from the National Wildfire Coordination Group. Very, very good sources of information. Okay. Done part of this. What we're going to try to do is get a handle on how we can use these types of tools, complexity analysis tools, to, there are many things, but these are some kind of high-profile pieces that we can get the decision support information on. One, identify the potential geographic extent and magnitude of the disease. We are wrestling with that here on the Newcastle's response in Southern California and all these communities. Assessment of risk to markets and trade. You know, we talk of regionalization, justifications on those types of things. How do we prove to our trade partners that what we say about the status of our risk is correct? You know, those are big deals. Assessment of the technical difficulty in mitigating the risk to what we're trying to do. And find a final complexity determination that identifies the minimum required national veterinary stockpile assets and requirements, and to inform the incident management team so that they can properly create the organization to respond appropriately. And when, you know, this is kind of a large topic, and this process that we're describing puts an orderly way of assessing all these various factors and risks and pieces of information, political, jurisdictional, the idiosyncrasies of local rules, regional rules and laws, state rules and laws, and USDA and other national priorities, programs, regulations, laws, you know, the things that we have to do and abide by. Part one, determine relative risk and give it a value, be able to rate it, quantify it. Part two, how difficult will the proposed tactics or whatever be to pull off, and how do we value that? Part three, determine other concerns, decision concerns, and assign a value to those. And four, you can input these kind of relative factors that you have assigned values to, and that allows you to better describe the needs or the concerns or whatever you need to provide to justify your response, to inform your agency administrators to help them make their decisions better, and get that in a format that you quantified these elusive values and made them so that you can consistently rate all these things and help make the decisions. Okay, and this is just, I screenshotted out of one of the NWCG organizational needs documents, and you can see that it's a kind of a typical chart that assigns risk and other factors, high risk, medium risk, low risk, and so on. And this is about, staffing and the qualifications of the type of incident management team that you should assign. And as the difficulty increases, like whatever metrics you've assigned, it describes that the qualifications of the teams need to be higher. They need to be more capable, more experienced, and bring more to the response. So those are simple. This is a simple example, and this is applicable to different areas of the organization that you're trying to assemble, or the resources you're trying to acquire, or the political complexities that you're trying to assess. And so, again, we're trying to bring some organization, some consistency in how we can quantify the complexity that we all deal with in responding to these incidents. And that can be something, these types of analysis tools can give you a general idea of this is very complex, you need probably more experienced people to management. Some of these tools can even be prescriptive and say, if you've got situation X, Y, Z, you need resources A, B, C. So there's a variety of tools out there, and we're just starting to get a good look at them, and we will see a little later of some point animal disease specific developments of this kind of a tool. Right now, I would hand it off to Mr. Darrell Swilling for the next piece of our presentation. Thank you. And remember, put questions in the chat. Oops, sorry, Darrell. Put questions in the chat, or then we'll go on. Sorry. Go ahead.
Thank you, Leslie. And good morning, everyone. I'm going to talk a little bit about how the wildland fire agencies use complexity analysis, a little bit of our history, just because I think it will apply to any efforts that you go through, and then how that applies to your situation and hopefully lead into the next presenter. So we'll see how that works. But we developed a complexity analysis for wildland fire for two reasons: to analyze incident complexity and provide guidance to select the incident management organization needed. Specifically, whether we needed a Type 2 or a Type 1 IMT. And we needed that for our agency administrators to make an informed decision beyond just something like, it got big, order help. What do we need to order? And so the wildland fire IMTs are typed, and those types have very descriptive and definite training and experience requirements. And so we don't want to put a Type 2 team and a Type 2 IC on a fire that requires Type 1 qualifications. And at the same time, we don't want to put a Type 1 IMT on a Type 2 fire where they're overqualified and their skills could be used elsewhere when we have limited resources. So it's an important decision, and it's one that we want to make an informed decision, and that's what the complexity analysis was developed for. The first ones were fairly simple. A yes-no checklist with a go Type 1, go Type 2, and easy and done. And what we found over the years as we worked with them is that it wasn't meeting all the needs of the agency administrator, and mostly for a couple reasons. The first complexity analysis didn't consider Type 3s. Type 3 organization is more of a local organization. We don't call it a team because they don't have the strict rosters and developed rosters and the same positions in everyone, and so really didn't consider that. But we found we use them as we get more incidents, and we seem to have more incidents these days. We use the Type 3 more and more, and there's concern that we were exceeding their capability with some of the incidents we assigned them to. So we need to adjust for that. And also, it was not responsive to the changing wildfire environment. As you know, the actual incident you're managing, if it's a fire or if it's avian influenza, that's probably not the only thing you're managing. There's all kinds of external influences, social and political values, such as communication and transportation systems, the local economy, impacts to metropolitan water systems, all those private timber values for us, all those values that you're managing for beyond just the immediate response to the disease or wildfire. And so as we were becoming kind of shifting our management from hazard mitigation to risk management, we needed to incorporate that into the complexity analysis. And so that complexity analysis changed and more into what you see today. And also we had a new decision support tool called WFDS, Wildland Fire Decision Support System. The only reason that's important is our complexity analysis became part of that system. And so it's now, and it lives through the whole life of the incident and beyond in the records. And so that complexity analysis really starts the identification of values at risk, the identification of where we think the incident is going with some modeling tools, and the organization needed. And if that changes, we make a new decision based on those changes and maybe, change the organization. So how does all that relate to your instance? Well, I think it's the same need. The decision's a little different. You don't have type 1, type 2, type 3 teams. You have state and national teams, and that's your decision. Your agency administrators just make a decision on what type of a organization structure they need. So that's the first decision, and within that, your incidents are different. Obviously, diseases are different. Avian influenza, low path compared to high path is totally different. Another type is totally different, but also there's a lot of factors. One of them that you have that we don't normally is geographic distribution. We fight fire one at a time. We have a fire, we assign an incident management team to it. Yes, we do complexes, and we can put 3 or 4 fires under one incident management team, but those are almost always in the same geographic location, in the same area, very close together, and they can easily manage. What I've witnessed on some of your incidents is you have premises in the central part of the state and other premises in the northeastern part of the state, better than a 2-hour drive. That adds a lot of complexity to your organization. You need a different organization to address that with the same number of premises that you would if they were all together. So there's a lot of different factors. Movement of livestock, the amount of the impact to local economy, the impact to national and international markets, how much industry is involved. In some places, industry will help with depop and disposal, and some places they don't. Are they, and then keeping up with the interaction with industry is also important. So there's a lot of factors that I see in your incidents that complexity analysis, starting to identify those at the beginning and carrying them through, not only gives the agency administrator an informed decision, it's also a communication tool with the IC that's coming in to manage the incident, with the agency executives, with state and local partners and industry to talk about, hey, this is where we think this is going, and this is why we're managing it with that type of organization. So that hopefully gives us a little picture of how it works for us, how it evolved, and I would think yours will evolve similar. It'll start with something that works, but probably you'll find other needs for it and expand on it. And hopefully that leads into what Maggie's going to talk about. So Maggie, I'll hand it off to you.
Great, thank you, Daryl. This is Maggie Baldwin with the Colorado Department of Ag, and thanks to everybody that's joining the call right now. I think this is a great topic, and hopefully you guys learned something. I'm really not talking just on behalf of myself, but Dr. Nick Striegel is our assistant state veterinarian, and he put a lot of work into this tool that we developed in Colorado, as well as Chuck Zale, who I have here with me, and he's going to be speaking after I get through my portion. So we're going to talk today about how we developed the Colorado FAD Consequence Complexity Analysis tool. So in 2017, we had a tabletop exercise, which we called AIM 2.5. AIM stands for Ag Incident Management. And this exercise was really designed to address the deployment of an IMT or the transition from a local IMT to a USDA federal IMT during a foreign animal disease response. And from that tabletop exercise, a couple of questions that we had that were very, very good in the after action report that came from our state Type 3 IMT team. One is, how will you know when you need us? And then two was, how will you know when the incident is too much and we're over our heads and we need to call in somebody else? And then also, if we have to request an IMT, we have to go to our elected officials or our Commissioner of Agriculture or our governor, and we have to say, you know, we need this money, we need these resources, and we need it now. And then they ask questions, well, how do you know you need that? How do you know that you need that many people or that type of team? And we say, well, it's really, really bad. And sure, we can quantify really bad in a foreign animal disease outbreak by maybe the number of premises that are affected or the number of positives we've had, but that really doesn't actually go through how the complexity works. There's a lot more that goes into the resources needed. So our question was, for an ag incident, can we quantify really bad? And we learned from Daryl that in wildland fires and even in our state, yes, they can quantify really bad, and there have been a lot of tools developed for complexity analysis in other aspects, for all hazards events, and then even for some specific, there's some specific health ones that they're working on here in Colorado for the medical side of things. So quantifying really bad has been around for a while. So the complexity analysis tool allows us to assign a numerical value to the scope and scale of incidents. And we decided we really need to do that for foreign animal disease incidents because just saying really bad is not very helpful for the decision makers. So it's really a subjective process that you go through to examine some factors, and I'll go through a few factors in one of our partners' complexity analysis. And really, this is a huge collaboration with our state agencies. We're very fortunate in Colorado that we work very, very closely with our emergency management at the state level and then also at the local level. And so we don't have to develop everything from ground zero. We can build off of what other folks have already done. And CDOT, the Colorado Department of Transportation, had developed a specific complexity analysis that was for CDOT incidents, and they can use it for all hazards incidents, but it's more for what do they need on their side. And some of the factors that they had to go through in their complexity analysis is environmental impact, threat to containment, disaster declaration, has one been declared or is it on the way? Is there one jurisdiction impacted or multiple jurisdictions impacted? And are they going to need special or night operations? So they had a lot of different factors that went into their complexity analysis tool. And the picture on the screen here is just a snapshot of the tool that they used. And I'll show you some of what we used. We kind of plagiarized what they did and turned it into an ag-specific complexity analysis. Currently, there are 24 factors in the ag-specific complexity analysis tool, and those include just a few that I'm going to name here, and then I'll go through some screenshots of what that looks like. So anticipated incidence and prevalence of disease outbreak, anticipated duration of resource commitment, disease control and eradication measures, if there are quarantines or livestock movement controls and permitting being implemented, what are the needs for biosecurity, cleaning, and disinfection, as well as depopulation and disposal. So the tool itself that we developed is a spreadsheet. And if you take a look at what's on the screen here, there's some columns. So the first column is what is the element that we're looking at. So those are the first ones here on this page are more generic that kind of apply across the and then we have values that we assign. So value of 1, I'm going to go through on the next slide a couple of the specific ones for ag. So here, value of 1 for an anticipated incidence and prevalence of disease outbreak. The value of 1 is low level of spread. New premises would occur slowly with low morbidity and mortality. 1 species affected. There are few premises, 1 to 4, in close proximity. So value of 3 you would assign if it was moderate degree of spread with new premises popping up quickly. It affects multiple species between animals and indirect contact. There are several premises, somewhere between 5 and 9, in close proximity with susceptible species. And then a value of 5 would be given if there was rapid spread, multiple species affected, spread through animals and in indirect contact. There are many premises, over 10, in close proximity with susceptible species. So you put the value that you give in the column that says value assigned, and that's multiplied by the weight factor to give you total points. A couple of other factors that we look at is, we'll go through the disease introduction. So if it's a single disease introduction, value of 1. Few disease introductions, naturally caused, value of 3. Multiple disease introductions detected, source unknown, or intentional introduction suspected would be a value of 5. So you go through all of these factors and you assign values which multiply by your weight and give you a total points, and then those are cumulatively added and give you a total point value at the bottom. And the total points, you can see that there's a range. There's 5 different ranges. Type 5 would be, consider normal operations. We can handle this within our office at CDA or whatever your state office may be. A type 4 if you need more resources than what's normally in your office. A type 3 if you had to bring in a type 3 state team or maybe a type 3 USDA team. A type 2 obviously has more points, and then a type 1 is the highest value point. So we did this during, I think maybe it was after the AIM 2.5 exercise, which was a beginning of a foreign animal disease outbreak, and we had gotten a value of 207, which was a type 3 IMT. So who completes the complexity analysis? Well, pretty much anybody can use this tool. The incident commander should do it so they can, see where they're sitting, but maybe the incident commander does not have ag or foreign animal disease subject matter expertise. You need somebody that is able to go through these values and assign a rank that makes sense. So it's a good tool that will help both USDA and state animal health officials prepare for disease events, for either, if you're working through some exercises, see maybe what type of incident management team you would need. That's one thing that you can use for both federal and state officials. It also, if you go through all of these elements, it kind of serves as a checklist of resources needed. And maybe as you're going through these, it'll help you think of something that you hadn't thought of before. And really, it's the goal of using this is to assess whether your current management organization is sufficient or whether you need a higher typed IMT or more money for a higher typed IMT. And that's something that you can bring to your high decision makers to say this is why it's really bad and this is why we need this type of IMT and this much money. So in the future, this tool, the spreadsheet, we are hoping to post, I believe it's going to be posted on the VS NTEP SharePoint FADI site. And we're hoping, I think Liz Clark said that we could also send it out to folks if you entered your email address when you entered the webinar, that we could send it out that way as well. But what we would really like is for other states and entities to take this tool and use it in your state and, see if you come up with ideas, maybe things that we missed or, any suggested edits. Use it in some tabletop exercises or functional exercises and get feedback. We currently have a working group through the NTEP that worked on this complexity analysis after we developed it in Colorado. and we did get some feedback from them as well. So we're very thankful that we were invited to participate in that work group. So as you're going through this, once it's made available, go through and review the values and the weighting of each element. We just kind of took the bare bones of what CDOT had done and plugged in ag specific. So it's nothing that's set in stone, and maybe there's something that's, you know, specific to your state, so feel free to add that. But if you do have feedback, send it back to us. And then, you know, look at what the scores that you come out with, either in a tabletop or functional exercise at the bottom, and maybe something doesn't quite look right. So we'd like to know about that. We'd like to hear your feedback and see, you know, ways we can improve this and have it be made available and widely used across the country. So that is the end of my talk. So I'm going to turn it over to Chuck Vail from DHSEM.
Thanks, Maggie. My background, too, started in wildland fire, and I want everybody to kind of understand it, to carry on with what Darrell said. Wildfire has practiced this very well across the system, and I've been all over the United States in that. When I went to work for the state, one of the, because I came from a county emergency management position, it was obvious that we only had one in Colorado, and it was called wildfire. Well, when you get into all hazard events, it wasn't really helping us. So we pulled together a committee. We've worked hard, as Maggie said, and Colorado now has 6 complexity analysis developed. That doesn't mean that we're done, and it doesn't mean that they're all perfect. Simultaneously to that, Colorado now has 5 Type 3 all hazard incident management teams. We practiced this exercise that Maggie talked about by using one of the teams, which got us where we're at today. Yesterday, Colorado used its all hazards complexity analysis on a flood event in an exercise, and we found some things in it that needs tweaked. So basically we have 6. We started out with a general one for kind of all hazards thinking. We have a wildland fire. We have an EOC complexity. We have the foreign animal fed. We have a Colorado Department of Health one for basically people issues, and then the CDOT. All of them start out asking the same types of questions for the exact same reasons we've all been talking about, clearly important. We've got a new piece that's probably going to come out to all of us that will fit in here somewhere. FEMA has come out now with the idea of lifeline thinking, and it's just another way of trying to focus people and stay objective. But I think it starts to fit into some of the questions in the complexity analysis that we missed, and that is there something so bad that it's taken a lifeline down or causing other troubles? So we're working on that. I'm not sure exactly where that's going to go. But the bottom line is that we need to ensure that we're all on the same form. And I think Colorado's going to be challenged now. Maggie and I talked a while ago. We've got to figure out a way now. How do you name these so they're appropriate? And then where do they live so that, like this, when you're on a conference call and you ask, have you done a complexity analysis, and someone says yes, we got to make sure we're on the same one. So that's going to be a little bit challenging, but I think that's part of the all hazards challenge that we have. So one of the questions a while ago was who fills this out? The State Office of Emergency Management works very hard, very, very hard in Colorado to make sure the locals start it. We ask questions rapidly. Is there an incident commander? Is there, because sometimes you get started and there isn't one. Colorado has 9 field managers. I'm one of those 9. So one of us is out in that incident early on asking these questions. If the locals have filled one out to get us started, it sets the stage for why they think they need or want either help, resources, or money. I.e., have you declared a disaster emergency in your county? So we start out with them doing one, then I do one, not to degrade what has been done locally, but it gives us the opportunity to ask broader, more educated questions, maybe a less stressed environment than the local IC. So we kind of do that to see, are we all on the same page? If we started down this road in ag, we're very clear then, in just a very few questions, that we're going to have the state CDA with us to go, hey, this now we're leaning over to a problem, but it's an ag problem. So I think that's important so we get on the same page. Then we try very hard to get the locals to get into a rhythm of at least doing 2 of these per day or 1 per ops period. Now that's easily said, harder to do. But as Maggie said, it really does set the stage for not only getting political attention and dollars, but then sustaining them appropriately, i.e. is the incident getting worse or better? And then I would say, along the lines of what Darrell said, while the wildfire people have done a great job in building tools like WILTIS, Colorado uses WebEOC as an all-hazard approach across our entire state. And so one of the reasons that we like it is it's a place then to post the completed analysis, and there might be many of them throughout the whole event, that then allows us to go back to policy and say we made the right decisions at the right time all the way through the event, to include turning down the event and getting to a smaller. So I think it's a really big deal. And then I think my final 2 points are, with limited resources, dollars and people and IMTs, right? The state needs a trusted tool to prioritize these incidents. From a state perspective, and it was talked about a little while ago, we can have multiple incidents going on at the same time in the state. So how do we not only go to policy, but how do we use the 5 IMTs that we have correctly, and then reach into, do we need federal teams, yes or no, and then how do we manage those? So we believe this to be the proper approach. And then my final point, which I've used a lot, and I still think it's the most important thing we ever do, and that is we have to have a tool so we can get to policy on why we need dollars. It's easier said, as Maggie said, you just can't say, hey, it's a bad day and we want money. It's very, very hard to get dollars and to get sustained dollars for anything out of, all of these. So this is a way for us to get there and measure how we got there, so it's not quite as subjective. So that's the end of my comments.
All right, great. Liz, we'll turn it back over to you.
Okay. Do we have any questions?
Ladies and gentlemen, as we move into Q&A, please feel free to place yourself into the question queue by pressing #2 on your telephone keypad. You will hear a notification when your line is unmuted. At that time, please state your name and question, as well as who you'd like to answer your question. To submit a written question, once again, you may use the chat panel on the right-hand side of your screen, and make sure to choose all panelists from the Send To drop-down menu.
Okay, right now we don't have any written questions in the queue.
Yep. Once again, ladies and gentlemen, pressing #2 will indicate that you wish to ask a question over the phone. We've got our first caller. Caller, your line is being unmuted. Please state your name and question, as well as who you would like to answer your question.
Yes, good near afternoon. My name is Monty Chandler with USDA Wildlife Services, and we work within a realm as part of Wildlife Services with regards to managing wildlife disease, and in particular rabies management. We have circumstances that branch off into epizootic circumstances. Just think about this tool when we want to think of an outbreak in an area where we've been trying to contain rabies in its area, and we're trying to use buffer zones and so forth and eradicate rabies from certain areas, and then all of a sudden we may have an outbreak. And it seems like a good tool for this kind of an application as well. Just wanted anybody that could speak to that.
Monty, that's a great question. This is Maggie, and definitely, I think I could send you this directly if you wanted, if you don't have access to the NTEP website. But I think that this could definitely be adapted to a wildlife perspective. I think that's a great idea.
Thank you. Have circumstances that we arrive at when we need to decide whether we're going to do trap, vaccinate, and relocate or release. I think not relocate, but release, trap, vaccinate, release, to vaccinate, like raccoons, for instance. And we're into that pretty heavy out on Cape Cod. And that's when it all started. In 2004, we had the breach, and then, it's been a long, hard trek. But getting rabies back off the Cape has been a task. So I think for us, looking at something like this, if the circumstance ever repeats itself, I have to answer to the National Rabies Coordinator and so forth and so on. So I think this would be a good tool to have as a sit-down at the table when we talk about these things. Thank you.
Great. Monty, this is Leslie Cole, and I would just add to that. You see that these tools have been developed in collaboration. So I would suggest you seek someone that you interact with that might be in a community that already is adept at using these tools and familiar with them, and work, again, collaboratively like they've done in Colorado, towards adapting one of these models more specifically to your use and to provide what you need. Collaboration is a great thing.
And at this time, we did have another caller. Caller, your line is being unmuted.
Hi, this is Tracy Dutcher with USDA Veterinary Services in the Field Epi Investigation Services Group. I just wanted to comment on some of the similarities and offer if there's any value in collaborating further on some of the factors and criteria. Within Vet Services, we have developed a engagement considerations tool or matrix for determining when to engage in certain zoonotic disease events and how to prioritize those given the situation, some of the various factors, including political considerations and trade impacts and things like that. And we've built that. We haven't assigned numerical scores for a number of reasons, but I'd be happy to share that with you, Maggie, and others on the phone, and discussions about how some of these might synergize or leverage on each other, particularly related to
Tracy, that would be great if you could share that.
Yeah, absolutely.
Yeah. Tracy, would you say your name again, please?
Sure. This is Tracy Dutcher.
Thank
Maggie,
you.
I already have your contact information. I can connect that.
That would be great. Thank you so much.
Sure thing.
And at this time, there are no further questions in our queue. Once again, ladies and gentlemen, pressing #2 will indicate that you wish to ask a question.
And at this time, we don't have any written questions in the queue either.
Nope, at this time, there are no questions in the verbal queue. If you'd like, Liz, we can give it a few minutes to see if anyone does come up.
Yeah, I just got one comment that came through the written chat. Just wanted to comment that I'm excited to see the documentation. So I will go ahead, once I get the report back from AT&T with all the email addresses, Maggie, if you can send me the documents, I will send it out to everyone.
Okay, I'll do that.
While we're waiting to see if we have any other questions, I just wanted to remind everybody that we've got a lot of webinars coming up in the next month, into May, actually. Our next webinar is going to be on April 25th, and the topic is World Organization for Animal Health Global Review of National Contingency Plans. And the speaker is Jennifer McDougall. Dr. McDougall is now completing a 6-month internship with OIE at the headquarters in Paris. So that might be very interesting. So we do have a written question. Canadian Food Inspection Agency, Dr. Bobby Lindquist, you described the use of this analysis tool in exercises. Has it been applied for actual disease events? If yes, can you describe the event and the observations of the use of the tool?
This is Leslie, and I am Ops Branch Director here at the California VND Response, and we have circulated the tool between our plans chiefs as they've rotated throughout here and our incident commanders, and we've had some responses and use of the tool against this event. And we're kind of accumulating those responses and seeing how consistent they look and like that. So we are giving it kind of a test run on this event, the VND in California. But again, we're still kind of gathering data on that.
And Leslie, I know that the state folks did use it when the event first started because one of them was on our work group, so I think that's great. We did use this tool in Colorado. We use this tool to analyze past events, so past true events. We had a large vesicular stomatitis outbreak here in Colorado, and we used this tool to see if we did have the right type of team at the time. So it's kind of a retrospective use of the tool, but it did match up with what we thought the incident type should have been. So I think that it worked in that incident.
And at this time, we still have not received any questions on the line.
Is Liz Fernandez still on the line?
She should be.
No, I am, and I was muted, and I just can't so I am still on the line. I was just reminding everyone that we have another webinar on April 25th, and we have an additional 4 webinars in May, and that information will be sent out in the next couple of weeks.
Liz, would you like to give our attendees a bit more time to ask questions?
I think at this point, if we don't have any questions in the verbal queue or the written queue, I think we can close out the webinar. I'd like to thank all the presenters. You guys did a great job. I think it was very, very interesting, and it looks like a very important tool that hopefully people will use in the future. And I would like to say have a great rest of your day.
That concludes our conference. Thank you for using AT&T Event Conferencing Enhanced. You may now disconnect.